So today we're going to talk about joints. My name is Emily Walker. The three main categories of joints are the synarthrosis, amphiarthrosis, and diarthrosis joints. The synarthrosis joints are immovable, fibrous joints that absorb shock. This classification also includes sutures, which are irregularly grooved, articulating bone sheets in the skull, and syndesmoses, fibrous tissue connected bones, such as the mid-radio-ulnar joint, which is right here, connects those two bones. So, the amphiarthrosis joints are slightly more movable than the synarthrosis joints and are cartilaginous instead of fibrous. This includes the synchondroses, which are articulating bones, like the sternocostal joint right here, that are held together by hyaline cartilage. That's what connects the sternum and then the rib cage. The symphysis, which are the bones separated by fibrocartilage, such as the pubic symphysis down here. The third category of joint is diarthrosis, or synovial, which is freely movable joint. Its articulating bone surfaces are covered in articular cartilage. An articular capsule covers the joint, and the synovial membrane secretes synovial fluid as a lubricant. The subtypes of these synovial joints fall under one of the four categories of axes: non-axial, uniaxial, biaxial, and multiaxial. The gliding joints, such as the intermetatarsal and intertarsal joints, here, are almost flat and only allow for sliding movement, which makes them non-axial. This helps with the force of walking and running. So the hinge joints, such as the ulnohumeral and interphalangeal joints, the elbow right here, have strong collateral ligaments that restrict them to hinge-like movement, which makes them uniaxial. Pivot joints, such as the proximal and distal radio-ulnar joints, are also uniaxial. Condyloid joints, such as the radiocarpal joint, have convex and concave articulating bone surfaces that allow flexion, extension, abduction, adduction, and circumduction, which makes them biaxial. Saddle joints, such as the metacarpal joint of the thumb, right about here, has articulating bone surfaces shaped like that of a saddle. The saddle joint has the same movement as the condyloid joint, but with an increased range of motion, making it a biaxial joint as well. The final type of joint is the ball and socket joint, which includes things like the hip and the shoulder. These are the most movable joints. In terms of mobility, the order from most to least mobile is ball and socket, saddle, condyloid, pivot and hinge, and gliding. But in terms of most to least stable, it's the complete opposite order, because the more mobile, the least stable. So in terms of most to least stable, you have gliding, hinge and pivot, condyloid and saddle, and then you have ball and socket. So the proprioceptive neuromuscular facilitation is the most effective stretching procedures and involve alternating contraction and relaxation of agonist and antagonist muscles in order to act on the Golgi tendon response. The Golgi tendon organs are receptors that are stimulated when there is tension between the muscle and the tendons. The response is when the Golgi tendon senses this and sends a message to the spinal cord. The message to the spinal cord is then processed, and it returns in order to relax the muscle and reduce tension, and also to develop tension in the antagonist muscle in order to prevent injury. This PNF stretching is also so successful that it increases range of motion after just one session, but with longer lasting effects after 3 sessions at 3 times a week. Thank you.